We're here today at the World Suicide Prevention Walk with Lifeline, and the PHN, we fund organisations such as Lifeline to do some of this really valuable work in the community. As we saw here today, we had a lot of people coming together to talk about suicide, and it's just a really difficult conversation to have, but those conversations are really important. It's the sort of work that the Primary Health Network is able to do to fund organisations like Lifeline to promote really important questions, start really important conversations, and they're people that are actually working out in the community. So we're not a service provider, but we're a facilitator of services, and we fund some really important programs in the community.
Lifeline's been around for 51 years in 2017, started in Sydney, and you know, it's well known for our 13, 11, 14 crisis support number, but we're so much more than that. And we have a range of face-to-face counselling services that provide low cost and quick access to service for counselling. We have a range of training programs specifically around suicide prevention, so helping people have those conversations around suicide. It's not an easy topic to talk about, it's not an easy question to ask. We have retail shops around the place, and all of the money that comes in from our retail shops is funded straight back into our services here in the local community in Hunter and the Central Coast. And we have 550 people here in the local area. 85% of those are volunteers. So we're very privileged to have a wonderful group of people who work together to support our local community, and we're grateful to PHN for the funding that allows us to get out into the community.
From my perspective, personally and professionally, they're actually in the trenches with us. You know, they're quite often that first point of contact for so many people who are in crisis, reaching out for some type of help, and without Lifeline there would be no help.
I think what it is for us is it's a point of contact. It's a reference that we have, because we have limited resources and limited time sometimes, and people don't necessarily need to be transported or taken to definitive care, but they need ongoing support, and it's something that we are not able to provide in our capacity, but it's a point of reference, and a good point of reference that we can recommend. Pass on that number.
Well, my daughter was somebody who tapped into various services, and without those services, as a family, we would have been fairly lost. I've learnt a lot more about what Lifeline does in the time since Alia died, and as a key centre for people to tap into when they're in crisis, I think it's indispensable.
We are there together as a team. We take great pride in being there for the local community, and all of our work is for them.
Today, was a great opportunity to see the difference that it makes. There was some really moving stuff out there today, but there was some really important conversations that people were having.
It's about actually talking about it, and the fact that it is a real thing. There's something that we shouldn't be frightened of talking about. If you've got someone who's suffering in your life, that you need to have those tough conversations, but there's help out there, and Lifeline's part of that help network.
We've gathered here today at Dixon Park in Newcastle, and we had over 550 people come here to be in community with each other, to support each other, and to recognise the terrible tragedy that is suicide, but also to provide hope and offer hope to each other in the community that we can tackle this really challenging problem and work together to do that.
There were speeches, and I know we laid flowers and did all those things, which were fantastic, but just seeing a really big community of people stepping out together, that really touched me. But it's more than that. It's more than just a group of people who are stepping out. Later on I saw those people with a tear in their eyes. I saw those people hugging each other. So it wasn't just a group of people walking, it was a group of people who were walking together, and that was just really moving for me.